Have you ever wondered why Ozempic could be ruining your stomach? Today, we're going to introduce a topic that's been causing some curiosity: Ozempic. This is a medication often used by individuals managing their diabetes, but it might also be causing some unwelcome effects on your digestive system. Join us as we explore the impact of Ozempic on your stomach, backed by insights from seasoned medical experts. Stay tuned as we delve into the reasons why Ozempic may not be as friendly to your stomach as you think. Firstly, what exactly is Ozempic? It is a medication that is commonly used to manage type 2 diabetes. It belongs to a class of drugs known as GLP-1 receptor agonists, which work by mimicking the effects of a hormone in your body called glucagon-like peptide 1. This hormone is naturally released after you eat, signaling your pancreas to produce insulin and your liver to stop making glucose. Ozempic amplifies this process, helping decrease your blood sugar levels. It is administered once a week via injection, and it's typically used in conjunction with a healthy diet and regular exercise to effectively control blood sugar levels. Now, how does it interact with our bodies? When Ozempic enters your system, it slows down the rate at which your stomach empties after meals. This delay helps manage post-meal sugar spikes and promotes a feeling of fullness, which can aid in weight loss. Now that we know what Ozempic is and how it works, let's explore why it might be causing stomach issues. Before we delve deeper into the topic, we would like to remind you to subscribe to our channel for more informative videos like this one. Don't forget to turn on the notification bell so you won't miss any of our future updates. We also encourage you to share your thoughts or any personal experiences with Ozempic in the comments section below. Your input could be incredibly helpful to someone else in our community who's considering this medication or trying to manage its side effects. Remember, we're all in this together. We've spoken to some medical experts to get their insights on this matter. Now let's delve into the nitty-gritty. Dr. Jane Foster, a renowned gastroenterologist, explains that Ozempic, like any medication, can cause side effects, some of which can affect the stomach. She points out that Ozempic slows down gastric emptying, which is the process of food moving from the stomach to the small intestine. This can result in discomfort, bloating, and even nausea for many patients. Dr. Foster's insights are echoed by Dr. Michael Ross, a leading endocrinologist. He highlights that Ozempic works by mimicking a hormone called GLP-1, which is naturally present in our bodies. This hormone helps to regulate our blood sugar levels. However, when the levels of this hormone are artificially elevated through medication like Ozempic, it can interfere with the natural functioning of our digestive system, leading to potential stomach issues. Adding another perspective, Dr. Lisa Nguyen, a pharmacist, brings our attention to the fact that each individual reacts differently to medication. Some people may experience stomach problems with Ozempic, while others might not have any issues at all. She emphasizes the importance of discussing any concerns with your healthcare provider, who can help navigate these potential side effects. Meanwhile, nutrition expert Dr. Paul Adams suggests that dietary changes can often help manage stomach discomfort associated with Ozempic. He recommends eating smaller, more frequent meals and avoiding foods that are hard to digest. Finally, Dr. Rebecca Lee, a research scientist, reiterates that Ozempic, like any medication, is a balance of benefits and potential drawbacks. It's crucial to remember that while stomach discomfort can be an unpleasant side effect, Ozempic also provides significant benefits, particularly for those managing diabetes. So, what's the takeaway from all these expert insights? Well, it's clear that while Ozempic can cause stomach issues for some, it's not a universal experience. And while it can be a challenge to manage these side effects, it's certainly not insurmountable. As we've heard from our experts, Ozempic's interaction with our bodies might not always be beneficial. So, what are the common side effects of Ozempic that relate to our stomachs? This question is certainly a crucial one, as many patients using Ozempic report a variety of stomach-related side effects. Let's delve into what some of these common side effects are. Firstly, nausea is a common side effect experienced by many. It's that unpleasant sensation that you're going to vomit, which can be quite disruptive to your day. This feeling may be mild and short-lived, or it might persist, causing significant discomfort. Secondly, some patients might experience vomiting. This is when the body forcefully expels the contents of the stomach through the mouth. It can be an incredibly uncomfortable experience and, if it happens frequently, can lead to dehydration and other health complications. Diarrhea is another side effect that some patients report. This involves loose or watery stools, often accompanied by an urgent need to have a bowel movement. Diarrhea can lead to dehydration if not properly managed, and can also cause significant discomfort and disruption to daily activities. Lastly, let's talk about abdominal pain. This is another common side effect of Ozempic. Abdominal pain can range from a mild ache to a sharp, severe pain. It can be constant or intermittent, and might be localized to one area of the abdomen or felt more broadly. It's important to note that these side effects are not experienced by everyone who takes Ozempic. Some people may not experience any side effects at all, while others may have only mild symptoms. The severity and duration of side effects can also vary widely from person to person. Moreover, it's crucial to remember that these side effects, while uncomfortable, are usually a sign that the body is adjusting to the medication. In many cases, they will lessen or disappear completely over time as the body becomes more accustomed to the drug. Those who experience these side effects often find them difficult to manage, but it's important to remember that not everyone will have these reactions. As always, if you're experiencing severe or persistent side effects, it's important to reach out to a healthcare professional for advice and support. If you're on Ozempic and are experiencing these side effects, there are ways to manage them. It's not a one-size-fits-all situation, and it's important to remember that everyone's body reacts differently. But don't worry, we're here to help you navigate through it. Firstly, dietary changes can have a significant impact. Consuming smaller, more frequent meals throughout the day instead of 3 large ones can help to ease the burden on your stomach. It's also beneficial to incorporate more fiber into your diet. Fiber aids digestion and can help to mitigate some of the stomach issues you're experiencing. Be mindful of what you're eating, as certain foods can exacerbate these symptoms. Spicy, fatty, or greasy foods can cause an upset stomach, so it may be wise to avoid these. Secondly, the timing of your medication can also play a role. Taking Ozempic with meals or at night may help to reduce the occurrence of stomach issues. Remember, it's not about rushing through your regimen, but rather finding the right rhythm that suits your body. Lastly, seeking medical advice is an essential step in managing these side effects. If your symptoms persist or become severe, it's crucial that you consult your healthcare provider. They can provide guidance tailored to your specific circumstances and may suggest alternative medications or dosages. In some cases, your healthcare provider may recommend over-the-counter medications to manage symptoms. Or in more severe cases, they may suggest a different medication altogether. Remember, the aim is to control your diabetes effectively without causing unnecessary discomfort. The key takeaway here is that you're not alone in this. Many people experience these side effects, and there are strategies to manage them. It's all about finding what works best for you and your body. And as always, don't forget to maintain a healthy lifestyle with regular exercise and a balanced diet. These not only help manage the side effects of Ozempic, but also contribute to your overall well-being. Remember, it's crucial to consult your healthcare provider before making any changes to your medication regimen. As we conclude, let's summarize the main points we've discussed today. We've dived into the world of Ozempic, a medication that has been a game-changer for many people, especially those grappling with type 2 diabetes. It's a once-weekly injectable solution that assists in controlling blood sugar levels and, in some cases, can even aid in weight loss. But as we've seen, it's not all sunshine and rainbows. There are potential side effects that can impact your stomach health. Nausea, vomiting, diarrhea, abdominal pain, and decreased appetite are all common side effects that some people experience when taking Ozempic. These can be uncomfortable and, in some cases, quite debilitating. We also heard from medical experts who provided us with valuable insights. They emphasized that while Ozempic can be highly effective, it's not a one-size-fits-all solution. Each person's body is unique and reacts differently to medication. What works wonders for one person might cause discomfort for another. It's crucial to keep this in mind and understand that experiencing side effects doesn't necessarily mean Ozempic is bad. It simply means it might not be the right fit for you. But don't fret, there are ways to prevent and manage these side effects. Drinking plenty of water, eating smaller meals throughout the day, and avoiding foods that upset your stomach are some of the simple steps you can take. It's also important to communicate with your healthcare provider about any discomfort you're experiencing. They can make adjustments to your dosage or suggest alternatives to ensure you're receiving the best care possible. While Ozempic can be beneficial for many, it's essential to be aware of its potential side effects and how to manage them. Always consult with your healthcare provider for the best advice. Your health is a journey, and it's important to make informed decisions along the way. So keep learning, keep asking questions, and most importantly, keep prioritizing your well-being. Thank you for watching. And remember to take care of your health. It's the greatest asset you have. Until next time, stay informed and stay healthy. Subscribe to the channel, activate the notification bell, and share your opinion with us in the comments.